Your Texas permit test could ask any of these. 20 real questions from the official handbook, answers explained one by one. Count your correct answers as we go. Here comes question 1. Question 1. The best way to check your following distance is A. Count car lengths. B. Estimate in feet. C. Use the 3-second rule. D. Watch your speedometer. The correct answer is C. Pick a fixed object. When the vehicle ahead passes it, count seconds until you reach it. Should be at least 3 seconds. Question 2. Refusing a breath or blood test under Texas implied consent law results in A. No penalty, you have the right to refuse. B. A 30-day license suspension for first offense. C. A $100 fine only. D. Automatic license suspension of at least 180 days. The correct answer is D. Texas implied consent law means every driver on public roads consents to chemical testing upon lawful arrest for DWI. Refusing results in automatic ALR suspension, 180 days for a first refusal, 2 years for a second. The suspension is separate from any DWI criminal penalties. Question 3. What is trip planning and how does it reduce crash risk? A. Buying a map before a road trip. B. Planning your route, estimated drive time, fuel stops, and rest breaks before departing reduces time pressure, prevents distracted in-car navigation, and allows scheduled fatigue breaks. C. Only necessary for trips over 300 miles. D. Required by law for drivers with CDL licenses. The correct answer is B. Pre-trip planning reduces the need to navigate while driving, eliminates time pressure, a major factor in aggressive driving, ensures scheduled rest stops, and allows you to identify potential hazard areas, construction, mountain passes in advance. Question 4. What is the safest way to change multiple lanes on a freeway? A. Move all the way across in one smooth motion. B. Change one lane at a time, checking each new lane for safety before proceeding to the next. C. Signal your full intended path and move all lanes simultaneously. D. Change lanes quickly to minimize time in adjacent lanes. The correct answer is B. Change one lane at a time on freeways. Check mirrors and blind spot. Signal, change one lane, verify the new lane is safe, then check mirrors and blind spot again before the next lane change. Question 5. What is the zipper merge technique at highway lane closures? A. Merging immediately when you first see a lane closed sign. B. Using the full length of the closing lane and alternating turns with traffic in the open lane at the merge point. C. A technique only for trucks and buses. D. Cutting in front of other vehicles at the last possible moment. The correct answer is B. The zipper merge is recommended by transportation agencies. Use the entire length of the closing lane and take turns merging at the designated merge point, one vehicle at a time. It reduces backup length and improves traffic flow. Question 6. This sign means A. The tracks are only used for scenic tours. B. This intersection has no railroad tracks nearby. C. This sign only applies if a train is currently visible. D. Railroad tracks run parallel to a side road that intersects here. Watch for trains, especially if you're turning onto that side road. The correct answer is D. This sign warns that tracks run alongside a road joining from the side. A driver turning onto that side road needs to check for trains along it. Question 7. In a construction zone, you should maintain what following distance from the vehicle ahead? A. 1 car length per 10 mph. B. The normal 2-second following distance. C. At least 3 seconds more than normal. D. As close as possible to keep traffic moving. The correct answer is C. Construction zones have more hazards and slower, unpredictable traffic. You should increase your following distance to at least 3 seconds to allow more stopping time. Question 8. What is overdriving your headlights? A. Using headlights in daylight when not necessary. B. Driving so fast that you cannot stop within the distance illuminated by your headlights. C. Using high beams in fog. D. Leaving your headlights on when parked. The correct answer is B. Overdriving your headlights means driving faster than your ability to stop within the lit distance. At 60 mph on low beams, your sight distance is about 160 feet, but you need 240 feet to stop. Slow down or use high beams where appropriate. Question 9. If you're unsure whether a new prescription will impair your driving, what is the recommended first step? A. Take the full dose and see how you feel while driving to a familiar destination. B. Ask your doctor or pharmacist specifically about driving-related side effects before getting behind the wheel. C. Only worry about it if the label mentions drowsiness explicitly. D. Assume it's fine since it was prescribed by a doctor. The correct answer is B. A doctor or pharmacist can tell you whether a medication or a new dosage is likely to affect reaction time or alertness, which is safer than testing it out while actually driving. Question 10. What does defensive driving ultimately aim to prevent? A. Only preventing at-fault crashes. B. Crashes of all types, including those that would have been another driver's fault, by maintaining margins that allow escape even when others make errors. C. Only violations and citations. D. Only serious injury accidents. The correct answer is B. Defensive driving aims to prevent all crashes, even those technically caused by others. By maintaining margins, scanning ahead, and having escape routes, a defensive driver can avoid a crash that an inattentive driver would suffer even when they had right-of-way. Question 11. What does an END school zone sign indicate? A. School is dismissed for the day. B. The reduced school zone speed limit no longer applies beyond this point. Resume normal posted speed. C. A school bus route ends at this point. D. Children must no longer be present on the road. The correct answer is B. End school zone signs mark where school zone regulations, reduced speed, heightened pedestrian attention no longer apply. You may resume normal posted speeds beyond this sign. Question 12. This sign warns you that A. The road is closed to bicycles. B. Bicyclists may be crossing or entering the road. C. A bike lane begins ahead. D. Bicyclists must yield here. The correct answer is B. A bicycle crossing sign warns drivers that cyclists may cross or enter the roadway ahead. Slow down and watch for bicyclists. Question 13. What hand position and technique do many instructors teach for backing a vehicle with a trailer attached? A. Keep both hands at the top of the wheel at all times. B. Place your hand at the bottom of the steering wheel. Moving it right moves the trailer right and left moves it left. C. Steer exactly as you would without a trailer attached. D. Look only in the rearview mirror, never the side mirrors. The correct answer is B. Placing a hand at the bottom of the wheel while backing with a trailer makes the trailer's movement match your hand's direction, which many find more intuitive than the reversed motion of normal steering. Question 14. When parallel parking, what is the correct procedure? A. Pull in front first, then back in. B. Signal, pull alongside the vehicle ahead of the space, then back in at an angle, straighten out, and center the vehicle in the space. C. Back in straight if the space is large enough. D. Parallel parking requires a special permit in congested areas. The correct answer is B. Parallel park by signaling, pulling up alongside the vehicle ahead, reversing at a 45-degree angle into the space, then straightening wheels and centering. Your vehicle should be within 18 inches of the curb. Question 15. A weave lane is a lane where drivers A. May park briefly during traffic. B. Are not allowed to change lanes. C. Must drive below 25 mph. D. Both enter and exit the freeway in the same area. The correct answer is D. Weave areas combine entering and exiting traffic. Watch carefully, signal early, and leave extra space for vehicles crossing paths. Question 16. When driving at night and following another vehicle, you should dim your high beams when you are within A. 500 feet, B. 300 feet, C. 200 feet, D. 100 feet. The correct answer is B. When following another vehicle at night, you must dim your high beams when within 300 feet of the vehicle ahead to prevent blinding the driver through their mirrors. Question 17. At a roundabout, you should travel A. Clockwise, looking left for traffic, B. Counterclockwise to the right, yielding to traffic already in the circle, C. In either direction based on your destination, D. Stop and wait for signals. The correct answer is B. In the United States, all roundabout traffic moves counterclockwise, veering to the right at entry. Keep right as you enter and travel counterclockwise to your exit. Question 18. What minimum liability coverage is required in most states? A. No minimum liability insurance is optional in most states. B. Bodily injury liability and property damage liability minimums, specific amounts vary by state but all require some coverage. C. Only property damage coverage is required. D. Full coverage, comprehensive plus collision, is required in all states. The correct answer is B. Most states require minimum liability coverage, bodily injury, per person and per accident, and property damage liability. Minimums vary. A common minimum is 25/50/25, $25, 000 per person /$50, 000 per accident /$25, 000 property damage. About 8 states require no-fault/PIP instead. Question 19. A properly fastened seatbelt should A. Be worn under the arm for a better fit, B. Have 2-3 inches of slack for comfort, C. Lie flat across the chest and hips with no slack, D. Be loose enough to allow free arm movement. The correct answer is C. A seat belt must lie snugly against your body with no slack. Excess slack allows your body to move too far forward in a crash before the belt engages, reducing its effectiveness. Question 20. An overhead lane control signal showing a steady yellow X above your lane means A. That lane is closing ahead, move to another lane as soon as safely possible. B. The lane is closed and you may not use it at all. C. You must stop immediately in that lane. D. The lane is reserved for HOV traffic only. The correct answer is A. A steady yellow X warns that the lane control signal is about to change to a red X, indicating the lane is about to close, so drivers should move over before the closure takes effect. Nice work making it to the end. For the full Texas practice experience, every sign, every rule, completely free, head to dmvprep.org/app or search DMV Prep in your app store. Your first try pass starts there.